The other muscle that I think you might be having an issue with, and I just want to try this.
Okay.
I think you had told me that you'd had some issues with your scalenes, right?
Yes.
Yeah. So I see people all the time, and if any massage therapist watches this later, this is one of those weird things where people will ask me about shoulder pain, but shoulder pain can be coming from somewhere else. The anterior scalene is the easiest of the scalene muscles to find and work on. And I find what happens is people wind up sitting like at a computer. And what they do is they're typing like this. So when you do this, one, you're driving, you're doing this, you're using infraspinatus to like lift the head of the humerus, one. Two, most people do this. And when they do this, it's activating it's activating the anterior scalene to like shorten, to like pull the head and neck forward. The anterior scalene is the one that's most in the front. So they wind up pulling the head forward, and they come to me and say, you know, I have carpal tunnel syndrome, or I have shoulder pain. The thing is, I could work on their hands, I could work on their shoulder, and it wouldn't get better. And the reason is the nerve trunks that exit the lower cervical vertebra go down the arm. So they could feel pains, like I feel pain in my elbow, I got tennis elbow, I feel pain in my hand and wrist, I got carpal tunnel. And then you'd find out that the scalenes were at least involved in what they were dealing with. So when you've worked on that before, how do you access that? Because you said you'd worked on it. Was it from the video on YouTube?
Yeah, I have in the past before, years ago. You know, I'll occasionally try again, but all I do really is sometimes I'll lie down in bed or support myself on my bed, out of my bed frame, or I'll sit up like this so that they're tighter. But I basically just look for any tight spot that causes the referred pain, and usually it's near the middle of my back. I forgot if that's levator or whatever, but middle of my back. Sometimes it would cause pain in the posterior delt region, but any that causes pain here, I just could keep pressing it and kind of flick it sometimes back and forth. I most recently tried this last night, but yeah, not entirely sure how you're supposed to do it, especially the tricky ones like this, right?
So and for me, like I'm a guy who like when I have a problem with something, I don't know how to do something. I gotta change the windshield wiper sprayers on my car, and I go to YouTube. And I order a plastic piece that I got to change, and then I'm watching YouTube videos trying to figure it out. I'm a very like fix it yourself if possible kind of person, where I think of it as a challenge. People having problem with their neck, problems with their shoulders, like I had a whiplash, which led me into massage. So I had to figure out, okay, there's the anterior scalene, but it's like in your neck and it's kind of to the side. I was like, how do I, like, because I could use my fingers, but then it's like I got to jam my fingers, like, and my hand would get tired. And then what I figured out was there's a muscle called your SCM, and your sternocleidomastoid. It goes from the mastoid process down to the sternum. Sternocleidomastoid. It's a muscle in your neck that you can grab and sort of pull forward. I'm trying to get like a better shot of this so you can see it, because I can pull this guy like away from my neck. I don't want to go in front because I can feel my carotid artery. I can feel my pulse right here. What I want to do is I want to be behind this muscle. And what I figured out was if I took in my case, I'm going to do my left side. If I took my thumb, I could reach, you see how the SCM is popping up?
Mm-hmm.
I could run my fingers back and forth and I go, ooh, man, what's this? What's that right there? And again, I'm going to pull the scalene up, the anterior scalene, so you can see this and see it's like anatomical location. So I'd come in and start pressing back and forth because I'm trying to find where it is in the front. I'm still behind the SCM. I'm still behind. You can see that right there. But when I would take my thumb pad and press down and in to my neck, it feels, I'm like, whoa, because I would get essentially a pain that would be deep, deep in this joint. I'm pressing in my neck. I can feel this in my shoulder. And then I could also move my head and neck around once I found it. Now, eventually my thumb will get tired, and then I'm just going to put my arm down and take a break. You could see the point there on my skin.
Okay. Is that not just wondering, is that strap here? Or is this the scale? Am I getting it, do you think?
The trapezius is in the posterior. We're really like in the side of the neck. And I'm going to show here on my right, what I'm pressing with is my thumb pad. And okay. I'm going to turn to the right here, so hopefully we can see this. I'm going to do it again on this side. Oh, and I'm just running my finger back and forth because I'm trying to find across the fibers. And I can find like this dense spot. Ooh, as soon as I press back and into my neck, it feels like I'm pressing into my spine from the side. I start to get like pain in the shoulder. I start to feel that nerve trunk.
Yeah, I'm getting that definitely right here. Does that look right?
So that looks right. So excuse me. Instead of pressing with with the point.
Oh, the pad. Okay.
I want you to press with the pad. I want you to press with that thumb pad, because I'm going to go back and forth. Ooh, right there. And then I'm going to press. Oh, it's like I'm pressing straight back and into my neck, and it lights up in my shoulder and over here.
Mm-hmm.
Is that lighting up for you?
Oh, yeah, definitely. I mean, I have spot like from here to here. Yeah. I didn't realize you could access it.
To make it even more complex, there's a set of 3 scalenes, okay? The anterior is the one in the front. The anterior is the one I teach to people first. There are muscles, the middle scalene and the posterior scalene, that are just behind that guy. But you'd use the same basic technique to work on all of them. Does it make sense?
Mm-hmm.
When you press into that anterior scalene, when you press into that, we just showed you that real quick, is it lighting up where you're feeling the pain?
Yeah, for sure. Definitely.
Like, just like the infraspinatus, when you press on that muscle, do you go, that's it?
Yeah, this one more so than the infraspinatus, because it's basically recreating exactly, my problem area.
So here's what you just told me. I would continue to work on the infraspinatus. You just told me, that's what I heard, is the problem is your anterior scalene. You could see therapist after therapist after therapist, and they'll do all manner of stuff to your shoulder, and they won't go into your neck. I've seen it time and again, repeatedly. When like, the thing is, it's not like, well, that's sort of it. No. When you find the muscle, they're like, that's it. That's exactly the pain I was having. I've seen people who've gone to a physical therapist for a year. The physical therapist just does exercises with them. And they come in and say, hey, I got this pain in my shoulder. And I go, where? And they're like, right here. And I'm like, right. And I press in their neck, and they're like, oh my God, why didn't the physical therapist tell me that? And I'm like, ooh, I'm not sure. Yeah. But I get paid to like, the thing is, my car sprayers can be replaced. I can't give you a new scalene. But I think if you work with your nervous system and work with it incrementally, just those 2 things, the infraspinatus and the anterior scalene, I think you should see some improvement.
Okay. So long term, I guess I've never been to a point where I can get this pain to go away for more than 2 days. But you think that would be possible with some maintenance and a good first treatment?
Yes.
Okay.
Yes. So 1, everything that would happen if you come from Houston and get a session with me, I'm essentially going to use my body to press on that stuff. You'll have a much more distinct awareness of like, oh, that muscle, like, because I know I've pressed on it a million times. It's like me, I have to look up schematics for my car and where do the tubes run for the windshield washer sprayers. But like a good mechanic knows, oh yeah, it's right here. And the thing is, we're trying to teach you to do some basic mechanics on yourself. My guess is like when you started talking to me today, 10 is the hospital, 0 is no pain. What was your?
With the right movement, I'd say a 5 or so.
Okay. What's the pain at now?
Well, it's kind of funny. I can't feel it really. So
okay.
I can't basically.
And is that normal or is that just because we worked on it?
I think it's because we worked on it. Yeah, I think so. I've never before though done this approach to the scalene. I have only done this.
Yeah. Yeah.
This.
So here, and the thing I'm trying to think about it, like I can do this, and I'm trying to think about why do I not? And the thing is, I think it's because it's these two fingers. I don't feel like it's as strong as this. I think that's why. So when I come in and I go, man, I gotta find this right here, because once I find it, I can press back and in, and it just lights up inside my shoulder joint over here.